Great, you were live. Good morning. It's March 21st in the Senate Judiciary. We're taking back up H2. And we have Nikki Duran with us on Zoom. Morning.
Hi, everyone.
Hi. Yeah, thanks for being here. We were just hoping to get a perspective from somebody who is engaged in this work on the daily, and just to hear what your thoughts are. And the floor is yours.
Thank you so much. I have prepared something in writing that will be shared, so I'm going to read that as my testimony. Hello, everyone. My name is Nikki Duran, and I'm a Family Services Supervisor in the Burlington District Office. I supervise the Juvenile Services team and previously was a worker on this team for nearly 4.5 years. The Burlington District Office has 5 identified juvenile services workers, and collectively our team holds 114 cases, averaging about 22 cases per worker. These 114 cases are made up of the at-risk cases, youth deemed to be beyond parental control, youth experiencing truancy, as well as youth engaging in delinquent behaviors and youthful offenders. When the need arises, this team also carries child protection cases. Currently, my team is holding 9 youth whose sole involvement with the department would be a raise the age case. We also hold several more who have co-current case types of raise the age delinquencies and youthful offender status. When young people are placed on juvenile probation, they are court ordered to complete juvenile probation conditions. These conditions are created to repair the harm of the incident and for the youth to engage in treatments specific to them and their identified risk areas. Workers complete a YASI, which stands for Youth Assessment Screening Instrument, with youth to identify these risk areas. Successful discharge from juvenile probation is achieved when youth complete these treatment recommendations prior to their probation term expiring. Due to our team of juvenile services workers having to support multiple case types, some of which they are the legal guardians for, the over 18-year-olds often get less case management support than would be ideal due to the impossible task of workers to triage all of the things they are responsible for to ensure child safety. In practice, youth between the ages of 18 to 22 do need more than our capacity allows. The day-to-day work with these young adults expands beyond just monitoring their probation conditions. Many of the youth we serve have complex needs, including support in finding safe and supportive long-term housing, substance misuse treatment, mental health treatment, opportunities to increase supportive peer connections, and educational and employment opportunities to support them as they continue into adulthood. Many of these youth have engaged in violent or aggressive behavior, which for some includes the use of a deadly weapon. When working directly with these youth, DCF needs to put in additional safety measures to protect the case manager from potential harm. In the last fiscal year, the Burlington office has been assigned 7 cases, which the offense explicitly involved the youth using a gun. Our office also serves many more youth who there is concern for possession and use of firearms with potentially dangerous effects. Unfortunately, our community struggles to have the adequate resources to support these young adults. Often, youth need to wait for identified individual counselors, and due to wait lists, if a youth is not consistent in their treatment and misses a session or 2, the provider will need to close the referral and move on to the next person on the wait list. Due to their age and oftentimes other circumstances, like some that I previously mentioned, youth 18 to 22 often miss appointments and need to be re-referred to services. The staff supporting these youth do their best to partner with the youth and support them engaging in their treatment. However, ultimately, it is on the youth to engage in the services needed to successfully complete their probation. Outside of wait lists, there are also limited resources to begin with that specialize in supporting youth in treatment for specific offenses. Currently, the state of Vermont does not have specific programming to target concerns for firearm violence, a resource desperately needed to address the safety issues in our community. And many times the community resources we typically access to support youth on our caseloads decline providing services due to the risk to their staff. This leaves youth who desperately need support, connection, and treatment in their same environment without the resources to make change and reduce their risk. There are also very limited providers with training to engage young people in treatment related to harmful sexualized behavior. There are often wait lists for this service for our youth, which impacts their ability to get the treatment they need to successfully discharge from probation. In addition to support, these youth also need accountability. Over the last several years, there have been multiple cases in which a youth on juvenile probation has not been successful in engaging in their court-ordered probation conditions and treatment. Despite workers' best efforts to engage these youth, we have at times needed to file violations of probation due to lack of engagement in their probation conditions. While filing these violations allows an opportunity for the youth and court parties to discuss why they are not able to be successful, there isn't any additional accountability filing these violations can offer in the juvenile delinquency docket. For some youth, it serves as a motivation to engage. However, others choose to wait out their probation term without additional consequences for not engaging in their probation conditions. This does a disservice to the youth, any identified victims, and the community at large, as the hope of juvenile probation is to have young people engage in treatment to reduce their likelihood of causing harm in the future. The individuals who provide case management to these young people do so because they care about the youth and their community. This work includes long hours, a level of intensity that most people do not experience as we sit with youth and families in their toughest moments. This work is done best with strong relationships and an ability to engage young people in tough conversations. Sometimes, though, this is not enough to have youth be successful on juvenile probation, and there does need to be consideration for how the system can best provide these young people with not just support, but also accountability. Thank you for your time, and I appreciate considering my testimony. I hope this gives you a better insight into the work family services workers devote to this population every day.
Thank you. Committee, any questions? Maybe this, if H2 were not to move forward and 19-year-olds were added, can you tell me just what would happen for the workers and their day-to-day operations?
Sure. I think that it would not give the workers the ability to, if their support of those youth throughout their probation conditions was not being successful, it wouldn't give workers the opportunity to pursue accountability like there is with the youthful offender probation model. I think that's the really big difference. Is the work with both populations looks the same. The youth that are on youthful offender probation have access to both Department of Corrections and DCF case management. A lot of the same barriers are there, wait lists, needing to close services if they miss opportunities, but there's a level of ability to hold youth accountable in the youthful offender process that isn't present in the delinquency. And so I think day-to-day workers would have potentially more cases where they aren't able to address their concerns for engagement, which I do think has a large impact on the worker when they feel like they are trying to support a youth to be successful and just aren't able to. So I think that would increase if H2 were not to move forward for workers.
And when you say, I feel like there's also a lot of different definitions that people have of accountability. In your eyes and the work you do, what does accountability mean?
Yeah. So before we get to the place of filing violations of probations, workers typically engage youth in other strategies, like we have some graduated sanctions, which are things that workers can put in place or have the youth engage in that are intended to increase accountability. Things like if a youth is frequently missing appointments or late to appointments, writing a reflection letter to think about and reflect and discuss how that might be impacting them as well as the providers that they're working with. We at times increase appointments to, check in with youth more frequently about at the next appointment, you're going to need to call this service to schedule a substance misuse assessment because it's part of your probation conditions. If that's not done, we'll need to meet again the next week instead of next month. So there's other things that workers do engage youth with that are intended to increase accountability prior to moving forward with filing a formal violation of probation. I think, like I said in my testimony, at times a violation of probation just allows an opportunity for the youth to come together with the other court parties and have a more significant at times conversation of the outcomes. If they do not kind of change their level of engagement. And at times that could result in extending a probation term. But at some point with the delinquency docket in particular, there is no other recourse. Like the youth do time out of their probation.
Thank you, Senator Rose.
Do you have numbers on how often that happens? Percentages, data points?
I would say in my district, there are 3 youth that I can think of in this moment over the last fiscal year. So since July, that is either actively happening or has happened. There may be other ones that I am not thinking of in this exact moment, but I know of at least 3.
And what is the total size? I'm just trying to get a sense of what percentage. 3 people doesn't seem like a lot, but I'm just trying to get a sense of, is that 3 out of 10 people? Is that 3 out of 100 people?
Yeah, so that would be 3. So as I said, currently, so open with us actively, there's 9 youth that would be like sole raise the age youth. And again, there are it's a little bit challenging because there are other youth that do have delinquencies that would fall under the current raise the age statute. But also have like other cases open with us, like youthful offender cases. So they're not just raise the age youth, if that makes sense. So the 3 that I reference, 1 is part of that 9, and then 2 are youth that have closed and already timed out. So 3 out of 11, potentially possibly more. So a pretty significant number out of the population that is currently.
Any further questions? Okay. Well, thank you for your time and testimony coming in.
Thank you.
Next up, we have Liz Ryan.
Good morning. Should I go ahead with, I have a written statement that I'd like to share.
Yep, floor is yours.
Okay, great. Thank you to the committee for having me testify today. My name is Liz Ryan, and I am here testifying in strong support of implementing Vermont's Raise the Age law for 19-year-olds. And I urge that you remove the pause on HR 2 from Raise the Age. I have worked in the juvenile justice field for more than 25 years. Most recently, I served as the administrator for the Office of Juvenile Justice and Delinquency Prevention at the U.S. Department of Justice, following appointment by President Biden, where I served for nearly 3 years. The Office of Juvenile Justice and Delinquency Prevention was established in 1974 under the Juvenile Justice and Delinquency Prevention Act to provide national leadership on juvenile justice, and it's the only federal agency that focuses exclusively on youth who are at risk or involved in the juvenile justice system. It provides over $400 million in funding to states and local government and to community-based organizations to prevent and reduce juvenile delinquency. It also provides training and technical assistance to the field, model program information, research, policy analysis, and guidance. And in my role as administrator, I set national priorities for the office, and those priorities were treat children as children, serve children at home with their families and in their communities, center directly impacted youth in the work, open up opportunities for justice-involved youth, and promote equity and fairness. As administrator, I supported efforts to reduce the prosecution of youth and young adults in adult criminal courts, and I supported efforts to reduce the overall incarceration of young people. And I can say in my experience, nearly 30 years of experience in the juvenile justice field, that states have been making tremendous progress on both of these areas, and that Vermont has been a leader in this area. Youth and young adults should be handled in family court rather than in criminal court. And the research on this is very supportive of that. There is research on adolescent brain development that I know you've been hearing in these hearings that tells us that teens and young adults are still maturing into their mid-20s, and they have a great capacity for change and should be supported in their efforts to do so. The research also tells us a great deal about what works to help youth and young adults to grow and thrive and desist out of delinquent behavior. We need to continue to invest in those kinds of strategies, and those strategies strengthen protective factors, provide opportunities for education, employment, and mentorship, and those strategies also address risk factors such as poverty and lack of supervision. The research also underscores that we should not unnecessarily criminalize behavior that can be handled in a more effective way in family court. Raise the Age is both a smart on crime approach that's fiscally responsible, it promotes public safety, and it supports rather than harms young people by investing in their rehabilitation rather than their incapacitation. The research tells us that most young people engage in delinquent behavior during their teenage years, and most young people age out of it. So it's critical that we invest in strategies that help accelerate young people aging out of delinquent behavior and not doing things that would increase the likelihood that young people would reoffend. And there are numerous studies that also show that prosecuting young people and young adults in adult criminal court increases the likelihood that they would reoffend. That concludes my statement, and I thank you for the opportunity to participate in today's hearing.
Thank you. Committee, any questions? I was curious if you have any thoughts or opinions about about the youthful offender program in Vermont and the youth participation in that.
You know, I would really defer to my Vermont colleagues who would have more expertise on Vermont's specific program on youthful offenders.
And you know, another piece of all of this is, you know, we've gotten a lot of different types of testimony, including testimony that there are decreasing, that there is less and less access to different types of programming for youth, and a lack of resources for DCF to engage in this work. Do you have any thoughts on that and how that could impact this?
Well, certainly you want to be smart on crime by investing resources in the most effective way. And what I've seen from your data, and I'm not an expert on Vermont, but what I've seen in your data is that your caseloads in the juvenile justice system have actually gone down since Raise the Age was implemented. So I think it's a matter of making sure that you're directing the resources to the appropriate programs, you know, shifting from where you were spending money and the population's gone down is now spending money on the population that you would be adding in. And certainly the kind of resources that you'd be investing would be things that research has shown works. And that's a greater return on investment for the state and ultimately would be beneficial overall for public safety and for those young people. And there's, if you're interested in getting programmatic information, I can send you information from OJDP. We released a model program guide, which has programs that have been evaluated, evidence-based programs evidence-based and evidence-informed programs that have been evaluated. So you can, if you search the kinds of programs that you're interested in investing in.
Thank you. Committee, anything? Okay. Thank you for your time. Appreciate it.
Thank you so much.
Next up, we have Patricia Casanova.
Good morning. I go by Tracy. My name is Tracy Casanova. Thank you so much for taking the time to let me come and speak with you guys today. I currently serve in the role as the DCF Family Services Labor Management Committee Chair. I have worked for DCF Family Services for over 22 years in a variety of different roles. For the first 13 years that I worked for Family Services, I was a social worker in the St. Albans District Office as a child protection worker, a juvenile services worker, and lastly, an investigator. I currently serve in the role as the Deputy Compact Administrator on the Interstate Compact on the Placement of Children, the Interstate Compact on Juveniles, and the Human Trafficking Consultant for the division. I'm here to speak to you today in my role as Chair of Labor Management through VSCA. I wanted to talk to you guys about the position regarding the Raise the Age initiative and why we need to continue to hit the pause button. Since the last time I testified at the legislature on this issue, last January of 2024, there have been some changes through our high-end system of care, which have helped stabilize our system. For example, the openings of Red Clover and our CATS team. While these are positive steps in the right direction, we are still not done, and we are still not ready to take on another initiative. Our community partners are still struggling to be fully staffed and operational. There are extensive wait lists for services, and our DCF turnover rate is leading to a diminished capacity within districts. This diminished capacity impacts workers' ability to fulfill state and federal requirements that they have to do on every single case that they have on their caseload. While we remember that our family services workers are not just juvenile services workers who are monitoring probation, they're also child protection workers. That means that in addition to completing YAZIs, writing up youthful offender consideration reports, writing case plans, meeting with youth to monitor probation conditions, they're also supervising visits for their CPS cases. They're transporting children to visitation and to other appointments. They're transporting them to and from school. They're attending court hearings, home visits, attending coordinated service plan meetings, coordinating and attending family meetings, doing family finding, traveling out of state to see their kids in residential programs, and that list goes on and on. Many of our district offices are so small that family services workers are carrying mixed caseloads, meaning that their juvenile services caseload, their caseload may include juvenile services cases of teenagers who are in custody as a result of child abuse or neglect, or they could be in custody as a result that they're beyond the control of their caregiver, truancy, or delinquency, or youthful offender. Here's what we know. Vermont families are still struggling. While the data may show that caseloads have not gone up, the data does not reflect the level of complexity that many of these cases hold. The way that cases are counted can be misleading. For example, while we still strive to place siblings together, large sibling groups can be challenging to place together. And I'm giving this strictly as an example, hypothetically, just to give you an understanding of it. So if we had a family who had 6 children who came into our care, that case of 6 children counts as one case within the division, not 6. And if those 6 children are placed in 6 different placements, okay, that's 6 different monthly home visits that worker needs to do in those 6 different locations that might not all be located in the same county that worker is working out of. And on January 15th, 2025, Deputy Commissioner Radke testified and shared that 34% of children in custody are placed as kin. And what we know is that when we place children with kin, those cases consume more time by workers related to the number of family members who want to provide support to the family and managing the complex family dynamics. Our division and workers value placing children with kin, and all of this impacts workload. Part of our federal requirements are that workers see the children in their home with their parents every single month. DCF system is only successful when our community partners are fully staffed and operational, as we rely heavily on our community partners to provide the supports and services to youth and families that they need in order to be successful. When the community is unable to provide the services and supports to children and families, the community looks to us. The community, schools, families, mental health agencies believe that DCF has its own special resources. We do not. We all have the same pool of resources that we are using. The community is feeling the complexity of these families and continues to turn to us as that we are one of the few AHS agencies that cannot say, I'm sorry, but we're full, or we don't have the staffing to meet those needs. We are required to respond. So how does this impact raise the age? When workers carry mixed caseloads, the priority will always be children in the DCF custody due to the requirements that the department holds as being these children's parents. Probationers and youthful offenders will always take the back seat when triaging is required. This triaging is now the norm versus the expectation. This level of complexity looks like kids who have experienced trauma, who have mental health issues, who are violent, who are gang involved, who are developmentally delayed and require personal care, or who are on the autism spectrum. With very few resources within our state, we are frequently moving kids within our system in order to meet the needs of kids who have most acute needs. This disrupts kids who are finally stable and sets them and their families up as they're not ready to be back in the community that quickly. Workers are doing the best they can to serve these kids and families, and it's taking a toll on them, which is leading to our turnover rate, which is between 16 and 17%, and that is just too high. We need our staff to stay, and we know that it takes approximately 2 years for workers to gain a full understanding of the job and be confident in their work. We know that one of the most important things that increases worker safety is our workers' ability to engage families, to have meaningful relationships, and to have trust to be built within those relationships. They can't do that when they feel like they're burnt out, overwhelmed, not valued, and unsafe. This has a trickle-down effect on the youth and families we're serving. Our staff are exhausted. Because of this high turnover rate in districts, the bulk of the hardest caseloads goes to the most experienced workers or those who've been there the longest, which essentially burns them out. And important case information gets lost with this high turnover. This turnover rate is causing some districts to operate at a 50% capacity rate. In these districts, we even have supervisors and directors caring for cases to help this capacity issue. This has even led to me carrying some interstate cases for out-of-state children who are residing in Vermont. So when I hear people saying that DCF has the resources and that we can manage taking raise the age, I'm telling you that we cannot right now. In the last 5 years, I have seen more supervisors, directors, and people within leadership who have been here for over 20 years decide that they need to leave, and with that goes the institutional knowledge. We have district directors who have been with the department for under 8 years. Approximately 50% of our directors have been within the roles for less than a year. A similar statistic is true for supervisors. We need our workforce stabilized, our community partners to be fully operational and staffed so that they can serve the needs of our children and families before we can take on any new initiatives. One of the other complicating factors that putting additional stress on our high-end system of care is regarding our out-of-state youth who are coming to Vermont for the purposes of trafficking guns, drugs, and engaging in violent crimes. Several of the homicides in the last couple of years have had a nexus to out-of-state youth ages 15 to 19. In my opinion, this has had to do with the lack of accountability within our system and state has with youth. I've heard from several prosecutors in my role who have shared with me that gang members in other states know that we do not have resources and that we are unable to hold anybody accountable. So they're intentionally sending youth here to engage in these acts, some of which would be considered forms of labor trafficking. They know that nothing will happen to them, that they will be released and sent home. In the 8 years that I've been in my role as Deputy Compact Administrator for the Interstate Compact on Juveniles, I have seen an increase in these trends of youth involved in drug trafficking, gun trafficking, and youth engaged in violent crimes. I also want to reiterate that our Vermont youth are also engaging in these types of delinquent acts. It's not just out-of-state kids. Since Red Clover, our secure stabilization program opened in October, and just as a reminder, we only have 4 beds. We have had now 4 out-of-state youth detained there, and one of them stayed there for at least 57 days while he was waiting for his charges to be resolved as required under the compact. Okay, that creates a diminished capacity for Vermont youth to be able, if they need that level, that type of setting. Our system shortfalls have a cumulative impact on our children, youth, families, and our staff. And I want to share some quotes from our youth and staff about the impacts of our high-end system of care. A youth who was in our care had shared the following with his family services worker after he was picked up from being on run. And this is a snapshot of what he said versus a direct quote. I ran away because I was not ready to be back in the community. You should have left me in depot longer. And this is from this same youth who shared another quote saying, after he ran away, to DCF, sorry that I made you waste your time. Hopefully when you catch me, if you do, this time I'll be ready to go to New Hampshire. Should have put me there. Sorry that I failed. And then I want to share with you some of the voices from our field, because it's really important, the people who are on the ground who are also doing the work, for you to hear about the things that they're struggling with right now and why they can't take on anymore. I write to express the struggles that your FSWs are facing daily. We are grossly understaffed in our office with high turnover rate, high caseload numbers. And though there are some of us with lower caseloads, the intensity and need of these cases we do have are equivalent to holding multiple cases. In addition, we are being asked to staff challenging youth and youth that have disabilities and need personal care support. During those staffings, we are being hit, bitten, having food thrown at us, changing diapers, administrating medication, and more that falls outside of the scope of our practice. We're often calling upon newer workers in a hierarchy when there is a need that's not met by volunteering. We are doing disservice to these new staff by asking them to perform duties outside of their scope and practice. I do believe that is contributing to the high turnover rate, and we are seeing more people sick, run down, employees who are struggling to meet the needs of the families we serve. We are sacrificing time with our own families and often sacrificing our own mental health and physical health to ensure we are being compliant and do not lose our jobs. I truly believe that if actions are not taken to address these concerns, employees will continue to leave the cycles of struggling that we're facing. Another worker said, when on call, if you get called out at night and must sit with a youth until the morning, although it's written that we can go home and sleep, most of the time we do not, because that means we must reschedule everything we had planned for that day. And if we do, it reschedules and pushes the worker further behind with what they already have to do. Workers also said that there's an inability for the department to keep competent workers. Good workers lead to poor leadership and a lack of communication and transparency. Another worker shared, first and foremost, the workload is extremely overwhelming, and I cannot effectively hold a caseload of 20 to 25 or higher. It isn't possible. It's unmanageable and, importantly, not safe or fair to the families that we serve. I cannot protect my own mental health. I am not safe from physical injury. I am overworked with caseload that is too high and too complicated. Staffing children has become more the norm and accepted. Family services workers are leaving more frequently due to stress, demand, lack of work-life balance, and high caseload. The amount of work that is expected to do on each case is impossible, especially when you have 20 to 25 cases. Deadlines cannot be met. Due to these things are getting missed, and calls and emails are also missed. There is no time to do actual social work. I feel that I'm triaging cases daily. There needs to be a change so that we aren't left short-staffed. The needs of our families have changed, and the state needs to change as well. I've worked for DCF Family Services for over 23 years, and I've seen things ebb and flow over the years. Over the past few years, the turnover has been ridiculous. We always seem to be short-staffed, and it's unfortunate that the extra cases and work then gets piled on to the experienced workers. I can't think of a time where I didn't have 20+ cases to manage, and that was on a good day. It is concerning that we are unable to maintain workers. Back in the day, people would stay for 30+ years, and now they are banging down the door to get out. It's not the work, it's the environment and the unmanageable caseloads. The expectations of workers here is out of control. We are constantly being asked to do more and take on more with little support. The courts, providers, schools, attorneys, and foster parents seem to think that we have the sustainability to continue on this path. Let me be clear, we do not. I look at early retirement just about every single day, trying to figure out a way to retire and meet my financial needs. When I started here in 2001, I was thrilled and felt like I could make a difference. Now I pray that nothing goes wrong. We are not meeting the state and federal guidelines, and it isn't because we are not going the extra mile. In fact, there are some here who work over 9 to 10 hours a day and get no compensation for the extra time they put in. I cannot effectively work a caseload of 15, 20, 25 or higher. It is not possible. It is not manageable, and it is not safe. I cannot sustain a positive attitude. I can no longer protect my mental health. I cannot even be safe from injury. I am overworked with a caseload that is too high and often too complicated to navigate alone. Staffing children is becoming more and more normal. Each month, someone from our office leaves, and each time it's because we as an office are too overburdened with work. Why are FSWs leaving? Because the caseloads are too high. The amount of work that's expected to be done on each case is impossible. The state and federal guidelines are not being met. We need more workers so the caseloads are smaller per worker and the work can be done. We can barely do any social work at all due to the constant state of crisis. My biggest fear that a child is going to die. Is that what will take for someone to listen? We are begging for change right now before the Rutland District Office is left without enough workers to sustain the needs and safety of children in our community. Society has changed, families have changed, the needs of families have changed, and the state must change with them. There are few resources to assist families in resolving the safety concerns within homes: mental health waitlist, substance abuse waitlist, lack of parenting support services, intimate partner violence resources. The list is endless. Our work is focused on child safety, yet the safety of staff is often overlooked. With all that we were asked to do each day, we are reminded often that we need a healthy work-life balance, and we are being pushed to the breaking point. Our staff
Chrissy,
retention rate.
Interrupt you real quick. We just have a few questions in the room.
Yes.
Senator Ruth and then Senator Wilson.
Thank you.
Yes.
I appreciate the testimony. I'm just having a hard time figuring out how this is not an indictment of DCF leadership and the administration. And the reason I say that is because the second phase of Raise the Age has been delayed. So all the problems you're describing have nothing to do with this law isn't in place yet. So all the problem, and please let me finish.
Yeah.
All the problems you're describing are due to chronic short staffing. And I've just noted some quotes. You say gang members, no, we don't have resources, so they come here. Triaging is the norm. Staff are exhausted. The workload is extremely overwhelming. We need more workers. And then we're short staffed, as repeated many, many times. That's the governor's responsibility. And correct me if I'm wrong, he's held you to a 3% increase in the budget. So how is it the fault of Raise the Age that your agency is apparently falling apart?
I don't think it's necessarily the fault of Raise the Age. It's really to say that the state that the system is right now and what the impact will further do on the system if we take on one more initiative that we don't have capacity to take on right now.
Yes,
And
but you're
part of the reason
describing
the
a status
system,
quo where it's, I mean, correct me if I'm wrong, you just described a hellish department.
the state of the state right now within the department is really challenging right now for workers who are in the field who are doing the work. And it's DCF is one part of a system that only operates it well when everything else is online and operating. So when our system, our community partners don't have capacity either, we're left holding to try to figure it out for them. So when the community is not, we can't take on new initiatives also when the community is not ready, because it will continue to fall to our shoulders.
We're not talking about new initiatives. We're talking about, you were just describing the way things are now without the new initiative. And you have a governor who's refusing to go above 3% for your agency. And every single sentence you said was that you were in desperate need of more people. So we don't control that. The governor is controlling that. So how is it not an indictment of the current state of affairs under Chris Winters and Phil Scott?
So again, I don't know if I necessarily agree with that analysis. I think the position is that we're one part and we need, and while I hear you saying that it's not taking on a new initiative, it would create increases within workload for the districts. And what I'm saying is that you have the power to hit the pause button on that, to
Yeah.
not increase, and for the division to not be responsible to taking on one more thing, to expanding what we're responsible for, because
No.
we're having a difficult time managing what we currently are responsible for.
I understand that, and I believe we have a bill to pause, raise the age 2 years. But what I'm saying is everything you're describing has nothing to do with this raise the age initiative. It is the facts on the ground that you are hearing and quoting from your workers on a daily basis about how extremely dysfunctional their department is. So I don't know, I take your testimony as a flashing red light that there are problems currently at DCF. So maybe that's what we should be focusing our hearing on once we pause raising the age.
I think it's not just DCF that I think that we need to talk to everybody, because there's this idea that what I'm hearing in other testimony is that DCF is adequately resourced in order to take on this additional caseload and workload, and we are not. And that's the connection that I'm trying to make with the stories that I was sharing directly from the field.
And
And
I
that
would just say that the governor is in charge of the resources that his agencies are asking for. So with that, I'll thank you for your testimony. I don't want to belabor the point, but I think you see where I'm going.
Thank you for your time. Are there any other questions?
Senator, yes, we have a few. Senator Holsky.
Yeah, I have a couple of questions. So I hear and certainly know of the many challenges at DCF. And I guess my question, obviously, it sounds like you need more people. What other resources are needed?
We need our community partners to be adequately resourced. So you hear about what Nikki was talking about in her prior testimony, that we are not a service provider. DCF is not a service provider. So we assess kids and families for their needs, and then we refer them out for services within their communities. And currently, when we're doing that, there are wait lists, there's not capacity in order for our community partners to work with us in tandem to help support kids and families with whatever it is that they're struggling with at that time. So the resources we need more positions, and the community, our community partners who do our barge work, our designated mental health agencies, substance abuse treatment. We have 0 residential juvenile substance abuse treatment here in Vermont for residential treatment. Anybody under the age of 18 who needs residential level substance abuse treatment needs to go out of state. So those are some of the examples. And Nikki and Lindy might be able to speak to this better in terms of like some of the trends of the needs of the youth who are on probation. But I can say on the cases that come across my desk on the interstate rolls, is that some kids are really struggling with substance abuse issues and mental health and past trauma. And so when that happens, we are referring them out for substance abuse treatment and assessments. And if we don't have providers in the community who can do that work and do it well, then we can't meet those needs. So those are examples of some of the types of resources, but Lindy could really speak more clearly to like what other specific services and needs that we need.
Thank you. So we've gotten some testimony because I have concern because we keep getting asked to pause this, and from year over year, people are coming in here, and to my view, it doesn't seem like much is being done to get us closer. So how have things changed since we were sitting here last year asking to pause, raise the age?
So I don't want to jinx it. Things are slowly getting a little bit better in terms of the opening of Red Clover has really been a big thing for our system. And while it's only 4 beds, and pretty much since it's been open, there's been an out-of-state youth holding at least one of those beds. That I think has helped in some of the stabilization of our system. The implementation of our CATS team, I think, has also helped stabilize and make things better. The number of staffings that are being asked of by our direct staff, I believe, has gone down. I don't have the numbers to be able to speak to that specifically, but it's beginning to feel like this has been going on for over 5 years now, that after 5 years, we're beginning to feel like we're turning the corner a little bit. So we do need more time. And I hear you that it's really frustrating to want to be asked to please hit the pause button yet again. And if we're going to be asked to do something, we want to be able to do it well and to meet the needs of the kids and families that we're serving. And we won't be able to do that if we're asked to, if we're required to take this on now.
Do you know what the current vacancy rate is at DCF?
I do not, but I am sure that Deputy Commissioner Radke might have that information.
And
I
the-
can get,
oh,
sorry.
No, go ahead.
Eric Radke, Deputy Commissioner for the Family Services Division, for the record. I can get those numbers for you, and I can send that to the committee. I also just wanted to say I agree with Tracy that we have had some improvements over the last 5 years, and I am finally starting to see a light at the end of the tunnel. But what she did identify that's really important is that the providers that actually help us are having difficulties getting staff and being able to provide those services. So that in combination with some of the other challenges that we are still working on really does make implementing this next phase of Raise the Age something that we don't feel we're able to do at this time and do it well. But I know that one of the committee members did mention we should talk about DCF and our work and what our workers are experiencing. And I'd welcome the opportunity to come back and do that and spend some time with that, and particularly bring in our workforce development director who has the data in terms of turnover rates and hiring and things like that. Thank you.
And the reason that I ask, and it is a bit to Senator Baruth's point about the chronic lack of investment in these services, and that's not on any of you. Those are decisions made at a higher pay grade, I suppose. But I took testimony in government operations just a couple days ago from DHR that there isn't a vacancy problem in state government, that we're back to pre-pandemic levels. And so I am significantly concerned hearing the stories that I'm hearing from you, yet also hearing from the administration that there's no problem. And it can't be both ways. It can't be that there's no problem and what you're describing is still going on. And so my skepticism about the investments needed and the desire to actually move forward with this is not on DCF. It is the chronic lack of investment in these types of supports and services that I have seen for at least the last 8 years. And so I want to be really clear. I hear what's happening. I'm a social worker myself. I work supporting some of your staff in my private practice, and I won't name more than that because it would be a HIPAA violation. I get it. And I hear it, and I hear it in all spaces. But what I don't see is the appropriate funding and response. And so I'm skeptical that if we just keep hitting pause, and we know we can just keep hitting pause, it's never going to happen. And again, that is not an indictment of the work in the community that I know you all are doing.
No, I appreciate that, and I do know that it is investments are important, and I know the investments that we have been making, it's been taking time, but I do point to Red Clover and a couple of projects we have that should be going up in Wyndham, where we are making those investments to make improvements, but it is not fast and it's not easy. I absolutely agree with you.
Senator Giles? Yeah, just kind of building off of Senator Vihovsky's point there. I just did a quick search on the state website, and in DCF, it looks like you're doing continuous recruitment for these family social workers. Are you finding it difficult to be able to hire folks just based on, the cost of living in Vermont, people moving out of the state, things of that nature, that even if you had 100 vacancies, you could fill those positions? Would you even have the ability to fill those positions based on everything that goes into living in Vermont? Because I was looking at the salary range, and it looks pretty healthy.
That's absolutely the case. And was able to get the most recent data for family services workers. We are down to 17 vacancies right now. And I believe it was at a high of 28 I can't remember exactly. It may have been 6 months ago. So we're slowly chipping away at the vacancies. But the issue absolutely is that we need the right people to do the work and that we're not always finding those types of folks that are able to do this hard work and have the heart and diligence necessary. But we are doing some targeted recruitment. We're working hard with using online investments. And like I said, I'd really like to bring the workforce development director in to talk specifically about this type of issue. But I think that's why we've been slowly chipping away at the number, is because of those things that we're doing. And also we have been reassigning some family services workers positions to central office to help us with some of the work that we need to do. So it's a combination that's been able to drive that vacancy number down, but it's not at zero, and we absolutely need more workers.
Any further testimony from Chrissy or
No.
Erica? Well, thank you for your time for coming in. Just think my questions were answered. Well, actually, do you have any information, and if you don't have the hard data, that's fine, but just turnover rates in general over the last, let's say, 5 years? Has the rate of people leaving DCF gone up, down, or has it stayed the same over the last several years?
You know, I can get you the data. We actually talked to our secretary's office and we had a chart, so I can find the info. I don't believe it went out the last 5 years, but it was lower in like 2019, and that it did really start to tip up. And I believe it was at 16%, but the last data that we saw as of yesterday, the turnover rate was back down to 6%. But that number was such a significant drop, we really did want to investigate to make sure that number was solid.
And do you have, if you're able to share this information, I'm assuming there are exit interviews for folks who leave. Are you able to share any general insight as to what folks describe as their reason for leaving?
Yes, I've done exit interviews myself, and typically I was going in expecting that it would be a lot of information about the high-end system of care and having the staff. And there's some people that have done that said that, but it's also just the general work-life balance because of the work. And then there are also a fair number of people that were talking about interpersonal relationships in the office in terms of supervisors or not, feeling like they were liked and that other people were favorites. So it's just sort of the general type of exit interview information that you would find in a company. It's not all, that I was being uh, asked to do things that I didn't feel I should. But there is some of that in the exit interviews as well. But it's a wide array of issues that are causing people to leave, including people just saying they're moving out of town. They find it too expensive to live here and things like that.
And this might have been mentioned earlier, but is it more so the newer folks who are leaving after a year or so because they see how things are going and they just want to leave? Or is it the folks who've been there, 10 plus years who are deciding they want to call it quits early? Or is it kind of a mix of the two?
It's a mix. It's a mix. And it is definitely, I mean, we want to keep all of our good workers, but when I see people that have been invested with FSD that have decided to leave, it's a blow because we value our workers.
Thanks. Committee, any further questions or comment for the witness? All right, thank you again.
Thank you,
And
everyone.
Marshall, by any chance, did you get any, were you able to get any information about 19-year-olds who are incarcerated?
I was not there. I sent out the email, but I haven't received a response.
No worries. Less than 24 hours, so I figured, but, since you're here, did you have any closing? I know you testified yesterday, you didn't have to agree with us.
Marshall Hall from the Office of the Defender General. Just briefly, the point I want to make is that our office's position is really driven by implementation, not by policy. When it comes to policy, I completely agree with Director Cole, who testified earlier. She is completely on point when it comes to policy. We do still maintain that this pause should take place. We're not happy about that, but facts of what would happen when it comes to implementation, I think you're seeing a difference between the testimony from people who know what would happen on April 1st if a 19-year-old comes in custody. I know the people who, once they reach DOC custody, there's always that period when they're in law enforcement custody, right? There's not a lot of control. But once they reach DOC custody, I know the people who are screening them in. I know the people who are being developing case plans around them to keep them safe in the facilities. And I know that it's not an ideal situation to have young people in an adult facility, but I also have faith in that system, in those people to do that right now. And I don't have faith that if 19-year-olds come to custody, if raising the age goes into effect on April 1st, that there will be safe spaces available because of, I think, exactly what was described by Ms. Casanova, which was that in these cases right now where they don't have spaces available, they end up staffing our youth with family services workers. And that, I completely agree with Ms. Casanova about the dangers of that and the problems with that. She focuses on that very appropriately from the perspective of the DCF worker. I also focus on that from the perspective of the youth, that it's really not a safe situation for the youth. We're taking youth who are in a state of crisis, who really need a clinical setting, and they need therapeutically trained staff, and we're putting them in a non-clinical setting with non-therapeutically trained staff, and that often is a recipe for disaster. It's not just bad for the staff, it's bad for the youth, it's bad for everyone. And that's what our concern is. Our concern is not that we want to pause because we don't want raise the age to be implemented. In fact, we want that badly. We are very excited for that. I can tell you that raising the age went into effect on April 1st, which we have our concerns about, and that's why we support the pause. I think that kind of all the offices who've spoken were the only ones to say, we're ready for that. We can handle that on April 1st. Our office can. But I agree that that DCF is stressed right now, the community partners are stressed, the closures affecting Valley Vista are going to affect all of this, even though it doesn't seem that way because it seems like we're talking about older youth, but Valley Vista accepts people over 18. So the population we're talking about is part of the population affected by the Valley Vista closures. And I'm afraid that we're going to start seeing more of that. I was just recently at a drug court meeting that included, people from the Judiciary, prosecutors, defense attorneys, Good Sam providing housing supports, local mental health providers, Valley Vista was there. And everybody was talking about what's happened to their organization since January 20th. And going around the room, everybody had things to report. Everybody was talking about federal funds that they received that are under threat. Strangely, we only want someone to say federal government's never really supported public defenders, so they don't have anything to take away from us. But that's the environment that we are in. And I think that it's just simply not the right time for this expansion. I wish it was. I wish we were in place when we had made those investments over the last few years, and that we were in a place that was resilient enough to handle the uncertainty right now, and that we were in a place where we had stable sources of funding that we were going to be able to rely on. That we were on a safe trajectory towards sort of recovering the stability of our system of care. I might be here in a different position, but I don't have faith in that right now. And because my main interest is not, as much as I care about the policy, and I do, my main interest is in our clients and what they're going to experience. And I know what the experience is for a 19-year-old arrested right now. And I know what the experience would be for a 19-year-old who was arrested if raising the age went into effect without the resources there for it. And I just worry about the safety of my clients. And I wish I could say otherwise. I wish I could say that I thought the resources were there and that we should just implement this and it'll work because there's actually enough resources there. I truly don't think there is. And so I just want to make clear that our position on this is not based on policy. We're not saying that we think it's good policy that laws raise the age, but we think that raising the age is a bad idea that shouldn't be implemented as soon as possible. It's just that our position is based on the on-the-ground effects of implementation and just imagining what it would do for our 19-year-old clients and where they might end up versus what they experienced at.
Marshall,
Yes.
based on your on-the-ground experience and the attorneys you work with regarding juvenile matters, their on-the-ground experience, just plainly, is it correct to say that if raise the age were to move forward, it would have a harmful impact on 19-year-olds?
I think there would have a harmful impact on certain 19-year-olds. I bet there's a large number of 19-year-olds where it would be fine. And that's actually true. Whenever we talk about problems in these systems, we're almost always talking about a very small number of cases that cause a very large number of problems. And that's typical. But that is, in fact, what we have to control for. We really have to control for those marginal cases because those marginal cases are what turn into real catastrophes. When you read about, you go back and read the 7 Days article about Woodside. I can't speak directly about the details of that because our office is obviously intimately involved in it, but because it was published, I can say, go back and read those articles. When you read that, you'll read about a catastrophe, about a real disaster that resulted in real harm to children who should not have been harmed. It was a very small number of children within the scope of the whole system. Within the whole system, for the most part, works well with most kids. But we really do have to watch out for those margins because those margins are where the catastrophes happen. And that's what I'm worried about. I'm not worried about the average 19-year-old who gets picked up for a disorderly conduct. I think that ECF actually does have the resources to handle that, and our court system has the resources to handle that. Our prosecutors and our attorneys have the resources to handle that. I'm worried about the cases that are more on the edges, cases that involve profound mental health disabilities or profound mental health treatment needs, serious risk that has been unaddressed for years. It's stuff where what we really need is heavy-duty programming, and that's what we lack.
Interject, but
Yeah.
the 19-year-old disorderly conduct example, is that something that would ordinarily go to a youthful offender?
Honestly, there's not a lot of consistency between counties, but you have to, maybe you can use sort of an anecdotal guess at that. I would say it's most likely to a diversion in most counties rather than youthful offender. Youthful offender is actually really not meant for 19-year-olds with disorderly conduct. That's a low risk, low needs type of offense. That's something that should go to diversion. That's something, that's a kid acting up at. Youthful offenders really meant for the high risk, high needs kids, the kids who are at the sort of highest end of the risk in the spectrum, the kids who have the most risk of committing further offense and the most need for treatment. And that's really where youthful offender stands out. I do see cases that are sort of inappropriately low risk and low needs being moved into youthful offender. I don't think that's always an appropriate use of the youthful offender process. I think that the youthful offender process is a pretty resource heavy process and really should be for those high needs youth, but it happens.
And just to put it on the record, youthful offender, which court does that go into?
Well, youthful offender is an appellate court status that uses the juvenile court as a venue. So it's essentially an adult deferred adjudication status with the juvenile court used as venue to provide confidentiality and also to provide access to juvenile specific services. Because DCF has services that are appropriate for 18, 19-year-olds for adolescents. And DOC really lacks that fast.
Senator Hoops.
Thank you, Marshall. I appreciate that we are talking about a narrow group of people, as you point out, very vulnerable people, but I remain unconvinced that they're better served by the adult court system than they would be by the raise the age. My question for you, and I realize it's going to sound like I'm asking you to speak for someone else, but I'm really not. The youth and child advocate holds a similar space of being there to protect the youth and children that are in the system, and they have a very different read on this situation. So I guess I'm trying to understand where that discrepancy is, given their charge is to protect the very clients that you're saying you are looking out for.
I can't speak to that. All I can say is, as attorneys, we have a naturally very conservative position about our clients. We don't like to trust our clients even we don't know them. We like to know what we are getting our clients into. And if we're engaged for going to affect financial workers, as attorneys, we don't know what we are getting the clients into. I do not know how DCF will resource things. I do not know how they would staff things. I do not know what my clients would experience. I do know what my clients will experience if the pause goes into effect. If the pause goes into effect, I know what happens to my 19-year-old clients. I know how they're treated. And from an attorney's perspective, representing individual clients, I don't feel like I can take a position and say that it would be better for our clients to be something where we don't know what implementation will look like, as opposed to the situation we have now, which is not ideal, but I do believe it's safe.
You don't ever know unless you have a crystal ball, we don't ever know what implementation is going to look like. So from that standpoint, it sounds like you would never support moving forward with this policy because you're never going to know what it looks like.
Oh no, we know exactly what we are looking for. We are looking for DCF to stop staffing children using workers in hotel rooms or other DCF or other spaces. From our perspective, that is one of the most dangerous things that happens to children in DCF custody, and is a marginal number of children that require that staffing. But it is one of the most dangerous things that happens, and it is still happening. And that is one of our major concerns. We haven't heard from DCF any explanation of what would happen tonight, except that they would be staffed. And frankly, we consider that dangerous. We don't consider that a safe situation.
Is the situation dangerous for 18-year-olds now? Because we've heard overwhelmingly that's very successfully been implemented.
I think it is in the sense that we have managed to keep most 18-year-olds out of custody, and so we haven't been running into the problems that I'm concerned about in 19.
Why would that be different for 19-year-olds? That we wouldn't be able to keep them out of custody?
There's more 19. So when we look back at pre-implementation of 18-year-olds, if you look at the numbers of 18-year-olds and 19-year-olds who were in DOC custody, there was a very, very small number of 18-year-olds in DOC custody. There's a huge spike up for the number of 19-year-olds in DOC custody. So we were expecting, and we saw that when 18-year-olds came into the system, that did not actually have a profound effect on the juvenile court system. We were able to absorb that relatively well. We expect that we will be able to absorb the 19-year-olds relatively well when everything is staffed up right. But we do expect that it's not a non-zero issue. I mean, I think the fact that this is a small and marginal number of people that we're talking about is being discussed as if that means that it can be easily accommodated. And it's actually the opposite. This is the small number of people they're the hardest to accommodate, the hardest to program, the hardest to resource. And we really do need those resources in place.
Thank you. Someone did email me the vacancy rates for DCF, and across the entire DCF system there, as of February 2025, there were 16 vacancies. So it's not a huge number. And I fail to see how the system resourced as it is now, how those 16 positions is going to make such a profound impact that we're suddenly ready to do this. If we're not now, which I remain somewhat unconvinced. But
I'm just confused about the state of affairs in DCF because I've never heard testimony like as Casanova before, never heard a deputy from an agency come in and describe the environment of their department in its, hellish terms, as we heard, repeated again and again and again by the deputy, not by critics or whistleblowers or anybody like that. And I understand there's a rhetorical need because we have a cause on the table and they want to make it seem dramatic that they can't do the 19-year-olds. But apart from that, what she was describing has nothing to do with the 19-year-olds because we paused that. It's not going to affect it. So it just seems like she was describing a department that is near collapse. And I just can't figure out a way to think about that other than chronic under-resourcing from the top. So I don't know how, if you don't change the priorities of the administration, how we would ever implement 19-year-olds, number one, but put that aside, how we would ever get to a fully functional DCF, which was not what was being described.
I can add, I think, I would agree that a hellish landscape was described, but there was also mention that things are, knock on wood, slowly getting better.
And that was my confusion, was it was a hellish landscape until we asked them about why do you have a hellish landscape? And then suddenly things were getting better and we were turning a corner and there was light at the end of the tunnel. So I remained confused about, is this tunnel hellish or is it lighted or both?
Well, I think you can have a hellish landscape with a light at the end of the tunnel that takes significant amount of time to get to that light. I mean, I'm thinking back to my former line of work when I thought, VSB was understaffed and, every couple of months, the new policy would come down that seemed completely asinine. And generally it came from the legislature, but, there were things that came down when we were, understaffed, overstressed and overworked that would turn a half-hour investigation into a 2 or 3 hour investigation. Just because of duplicative work that was now required by law. And when you have a shift in a couple of experienced troopers and a couple of new troopers, and you see both new troopers and experienced troopers saying, Jesus Christ, this job makes no sense anymore. We have vacancies, we keep getting these policies that are creating more work for us. I'm gonna either go to a different department or change my line of work. It's a feedback loop of being understaffed, being overworked, and then that creating vacancies. And then the vacancies cause that work to be dispersed to everybody who is able to stick it through. But even the people who are sticking around have their own threshold, and eventually they hit that threshold, they leave, create more work. And so I don't know if that analogy is applicable, but it's maybe somewhat. Consider those.
Yeah, I mean, I hear you, and I agree with Senator Baruth that it does feel challenging for me that we were getting told one story until we challenged that story, and then we're getting told another story about how hellish it is. But I also, the only other time I've heard testimony like this, that was last year when we were talking about raise the age, and the only time prior to that was the year before when we were. So that is where my skepticism lies. Is nothing seems to be moving forward.
Yeah.
And some of the testimony has been sort of conflicting, and when I'm hearing that youthful offender is actually a lot more work, so why wouldn't we do the easier thing? And so some of it has been very conflicting to me, where it seems like on the one hand we're saying we can't do this, but on the other hand we're saying actually things are better, and none of it. It all seems about as clear as mud, and I'm having a really tough time sitting with continuing to delay good policy for this murky mess that is painted.
I'm sorry, we're in committee discussion of Marcia to testify. What are we doing here?
Yeah, we're.
You sit down, I was looking for an excuse to go sit down. I was gonna wait for a few more minutes in the park. But if people are good.
No, there's not place. So I guess I'd like to add this. I understand the frustrations. I understand the concern. The one thing that you said that I agree with is if we have a problem with DCF or a potential problem with DCF or the administration or the governor, whoever we want to blame going forward, if this bill passes, I don't know where we started with this, Senator Bruce, but maybe you can form this task force, whatever, to look into this hellish situation happening in DCF. But if I got a 19-year-old who needs to cross a highway, okay, a heavily traveled highway, and it's not a crosswalk, and it's 100 feet up the road, so there's a crosswalk. I want to delay this a little bit, send them up to that crosswalk or her up to that crosswalk to make sure they get across safely. Okay, that's my concern here in listening to the testimony or whatever else. This isn't a matter of we need to get this 19 years of age. It's something we want to be personally and during the process of blaming certain administrators or whatever because of the process. If we have a concern about DCF, let's look into the concern about DCF. If we had a concern about the 3% of the governor's opting, let's do something about that. Let's move forward this. And if this gives us approximately 2 years, we're here testifying that we shouldn't be there right now. They want to be there, but they don't want to be there because it's not the right thing to do. So let's look at it from, okay, let's approach it from the angle. If we want this to happen, let's find out why it can't happen.
And I agree with everything. Because I'm not even talking about raise the age. I feel like the committee has already made its mind up on raising the age. I've changed my vote, pursuant to today's testimony. I was a yes. I'm now a no, but it has nothing to do with raise the age. I've just lost faith in DCF, and I'll just put it flatly. But with that said, I feel as though you're exactly right. If we're going to pause this, I'm just thinking of Ms. Casanova's testimony. So a deputy from the agency comes in and testifies for 25 minutes about near collapse conditions in that agency. I feel like as the oversight body for that, we really do have a responsibility. If, God forbid, something horrible happened 2 weeks from now in the agency, we heard from the deputy that workers are fearing for their mental health, that gang members are circulating information about how badly resourced we are, that people are near collapse, short-staffed, triaging is the norm, the workload is extremely overwhelming. All of those things I think are red flag for us. So I think you're right, Bob, that we should figure out the appropriate venue to investigate that. What, number one, we can have Commissioner Winters come in and speak to Ms. Casanova's testimony. Is that the state of affairs? Is it an emergency? And should we be creating incentives maybe for immediate hiring in the same way that we've talked about and implemented for DOC? Because it got to the point where we were worried about collapse of a prison. So anyway, I'll just advance my explanation on the vote. I really appreciate the chair's work on this bill and Martin's work in the House on this bill. And I think they've done absolutely the best they can. I walked in today as a yes, but after that testimony, I am a no. And it has very little to do with raise the age. It has to do with either the disingenuous nature of DCF or the near collapse nature of DCF. And I can't figure out which is which.
And I appreciate your opinion on that. I think it's separate issues.
Yeah.
How you vote is how you vote.
Yeah.
But the so-called disastrous position that they may or may not be in versus what we're dealing with here with H2, two separate issues. Well, you should penalize one issue because of your thoughts on another issue, but I do feel compelled that we must take action to at least start something because if this is a failing agency, which is a very large agency.
Yeah.
How do we begin to look into this agency?
Exactly.
Because you want this to move forward. Certain members really want this to move forward. That's fine.
Yeah.
Okay. I'm a no vote on this, so I'm gonna put it up publicly. Okay. I'm a yes vote on the H2.
Yeah.
Delaying it. So I'll put that out there as long as you did, but I think they're two separate issues here. We need to address them as two separate issues.
Well, I think it's up to whoever's making the vote, what they're responding to. We can only respond to the testimony we get from the agency, and I found it deeply problematic. So voting yes on a bill that they're here pushing for, seems to be the best way to get no reaction from them at all, because it will have been a successful tactic.
So when DOC was, and I was in the House then and heard the conversations about when DOC was near collapse, we didn't decriminalize things so fewer people went to jail. We didn't pause crimes so fewer people went to jail because that would be a public safety disaster. I'd argue we're in the same position where we have an agency that's near collapse and we're pausing good public safety policy. So
Instead of going.
instead of going in the other direction, we know that this policy, all of the data supports this policy being good for public safety. And when DOC was near collapse, we acted. We didn't say like, actually, we're going to stop sending people to jail because the department is near collapse. And so to me, they're not separate issues. And actually it is bad policy to say, well, the agency is a mess, so we're not going to make good policy.
And I would go even further and say the administration has come in every year to add crimes for public safety. Even though the DOC is stressed to the level they are. But
if we cared about public safety, we would be rocketed towards raise the age.
yeah, so with apologies to the chair, because I appreciate the work you've done on the initiative.
Well, I haven't done much, but thank you.
I also am curious why a 2-year pause. That seems like a long time.
Perhaps we'll have an administration that actually supports DCF 2 years. Just a thought.
I think caving and doing and delaying good policy is just bad policy.
I don't think anybody's angry. And some people have policies from a different perspective, good versus bad.
Well, the policy is already the
I
law.
appreciate your opinion, Senator.
The policy is already the law. We passed it in 2018. It was researched, it was vetted, it made it through the Senate, it made it through the House, it made it to the governor's desk where he signed it. Like the policy is already the law.
I'm kind of just at a point of where we're just gonna agree to disagree and, we're talking about, administration that may or may not support DCF. I don't think voting no on this bill when we hear that DCF is or is not close to falling off this cliff. I don't know if we should pass legislation that then pushes them off the cliff. Whether it's the policy, good, bad, indifferent. When you hear something like that, just that testimony about it, yesterday in finance about a different bill where various stakeholders, state government were against the bill, had big concerns about the bill. And we rushed it right through. Made an amendment at the last second, rushed it right through. So I think it's to a point where we're just gonna agree to disagree. I don't want to do something that puts DCF into a position where they are going to fail, based on the testimony we heard today. Right, push back a little bit. The administration doesn't care about DCF, but
I was being a bit flippant.
yes, but when we hear testimony from DCF that enacting this bill would be a big cause for concern for them. And that when they do have 16 vacancies, and if they can't hire, you can give them 100 vacancies. You can give them 100 positions. If they can't hire the people, it's not going to make a difference. And we have to acknowledge that the work that these folks do is very difficult. Arnie knows that probably better than any of us. So I'm just pausing, agreeing to disagree. So
I wonder, and I think it was the Office of the Child Advocate suggested a sort of halfway point where on April 1st misdemeanors go into the raising age category and everything else stays as it is now. I wonder if that is a step in the right direction where there's a good faith effort to actually take movement, and if that is something we can consider.
I think it's absolutely something we can consider. Because hitting the pause button or April 1st, once again, doesn't necessarily prohibit us from looking at a bill that we can somehow make germane, perhaps, in the coming weeks or months. Have to talk to that about that, but to see if that's a possibility. But yeah,
So my concern is once we hit the 2-year pause button, it's gonna be rather difficult to hit the unpause button.
right.
And to be clear, all along, I've preferred the pause to the review. So I appreciated that aspect of the legislation, the proposed legislation, that it wasn't getting rid of the policy, it was delaying it yet again. But yeah, I think it's fair to say that the government would not, probably not sign anything that had to do with expanding from where we are.
Which is why I'd rather see it here, where
Yeah.
we get the partial pause as opposed to a standalone on its own.
Right, but I mean, I don't know that he would sign
Right.
something like that when
Yeah.
it hits his desk.
Well, then April 1st, it goes into effect. Like, that's the choice he has. The whole thing goes into effect April 1st, or part of it goes into effect April 1st.
Yeah. Well, we also have the House with, so they made their position clear. So,
What about the possibility of rather a 2-year delay, a 1-year delay? And when we come back once again, a year from now, look at this. We take into consideration what you've described. Thoughts on that?
I'm certainly more comfortable with it than the 2-year delay.
I will say it's better, and I would be interested to hear the same witnesses next year. And I would ask if we went that route, we would review their testimony by video immediately before they testify and compare it to what they testify next year. Because my experience of this is that there, and I don't want to, I don't want to go too deeply into motivation. I will just say that the situation as it has been described has gotten worse, not better. So in other words, every year that we pause, they don't come in the next year and say, we're halfway there. Now we're 3/4 of the way here. It's gone like this. Now the testimony we got today was our agency is barely functioning. So I don't have confidence that if we put it out a year, we'll get our policy. But I would prefer a year as opposed to 2 years at this point.
No, I would just say I'd rather stick with the 2-year just because of that exact argument. We had a little tiny event that happened when this bill originally came in, COVID, that'll change quite a bit of things. So seeing that dip, as it is alarming, but kind of like with everything, state government, when COVID hit, it threw everything, monkey wrench into everything. So I want to be able to give DCF the time that they need to be able to come back up, come back out of that dip. It sounds like they're making some headway again, which way it is, maybe we hear from Commissioner Winters on that. But, sticking with that 2-year delay to be able to really give them the time to be able to do what the policy is setting forth.
For the 1 year as an additional accountability mechanism.
I was thinking accountability, but also the more creative approach of, can we contemplate some offenses that are less resource intensive than felonies? As a possibility.
What about an old fashioned check back?
Chinga.
So wait a second, how, I like it.
So in a year, come back, I don't know.
We had that under Senator Sears. We had some criteria that put in that they were gonna report to Joint Justice Oversight and else. In other words, it seems like we've got a couple of
I don't know, I mean, there's the timeline of getting this out, which I'd like to do in the next 30 minutes.
Oh.
But there is also, I mean, the check back, the reporting back, that's kind of what we just had. It had dwelling.
Get us any closer. Like, we did the check back last time and we're still here saying, nope, can't do it, which is what you predicted last year, that we're gonna do all this reporting and they're gonna come back next year and say, nope, still can't do it.
Yeah.
Whereas doing a year, it gives us like a real something to hold on to, like this is happening. Or some version of it, like there's just more teeth.
And I can vote for you.
Eric, I saw your hand up for a moment. Did you want to chime in on that?
Oh, just briefly, I really appreciate listening to you all and how you're grappling with this issue. And I just wanted to clarify one thing. When Ms. Casanova was testifying, part of her title is Deputy Compact Administrator, but I didn't want you to think that she's the deputy of the division. I'm the deputy of the division. So when you're thinking about information, how it's imparted, and who has the most current data, I have that view overall of the division. Whereas, she's working in a more narrow part of our division. So I just wanted to add that. And then we're absolutely, we would really welcome the opportunity to come back and talk about the state of the division. But thank you. And I appreciate you all with the work you're doing with grappling with H2.
So it's not.
Right, but it was trying to shift the word.
So this like. There's a vision. So sorry.
Well, no, finish.
No, I was just thinking, brought up my calendar here. We're on the 21st of March. So if we make an amendment to this bill, and then it's gonna go into the notice calendar, then on the floor, then back to the House. And then if they concur, or if they make an amendment.
Well, we can move it very quickly because we'll get rule suspensions on both sides.
Right, but I just don't know if they deliberate, if they,
I mean, in other words, it won't speed it up not to amend. Because if we amend right now, it'll take the same amount of time to get to the governor.
No, because if we amend then to go back to the House, if you don't amend, then it goes to the governor.
Well,
The House still has to vote, right?
House voted on it.
voted on it.
We'll get rule suspensions.
Yeah, I don't think since I'm assuming your party is four square behind this. We both lack for rule suspension. So if we wanted to, we could move it in a day.
Right, but I don't know, like going back to the House if we do an amendment.
No, but what I'm saying is we could get this to the governor by tomorrow if we have rule suspensions. That's how we adjourn at the end of the session. We move things 5 times in a day back and forth and then get them to the governor. So as long as we have the Republican minority on board, there's no problem with time.
Assuming the House Judiciary signs off on.
Well,
I suspect they'll be fine. That's my speculation.
and those are guys something to do. Person.
Well, I think we have, I don't want to make assumptions, I think we have at least 3 members who appear in support of a 1 year, changing it from 2 years to 1 year. So, Senator Morris.
Yeah. I don't know why we're starting with this so much here. Let's do looking at other areas that's blame here. But anyways, I could potentially go along with. It's supposed to be April 1. I could go along with a 1 year. If in fact we get a report back on April 1 of next year to tell us of their progress. And if they are making, you know what I'm saying? Let's not wait till July 1 before we, okay, let's do this. And we haven't had a report back from you.
Well,
So April 1 of next year.
It'll be April 1 next year.
But April 1 is when it would happen.
I thought it was July 1. We're looking at 2027.
No, it's April. I thought it was April.
April 1 is the implementation.
Implementation, July 1 is the new, I think this bill here.
Oh, there's a different. So it's a year and a half. Or a year.
Well, it's 2.5 years in that bill.
Yeah. But
We're suggesting a year.
yeah, but it's not a clean 2 years. It's 2 years plus 4 months. So
July 1.
So perhaps a report back on the feasibility of just including that, that was your.
On April 1.
Yeah.
Right. That's what I'm looking for.
Yeah.
Well,
Compromise I'm looking for.
we would want the report back before April 1.
maybe January.
Yeah.
Yes.
Okay.
Because
April one would be the day.
the
the go
implementation,
by
you want
day.
to know before that.
Well, January 15, and something.
We do have
lines of what we do.
progress reports in here too, in H2 already.
Yeah, but I don't think on the specific policy idea that Tanya or Senator Mahosky said a moment ago, with the incorporation of just misdemeanors.
That's very old missing. This is progress report or the suggestions, but what are we going, what are we going to do in interim as far as our concerns or your concerns about the direction that DCF is going in?
I think that is not to stop the conversation, but I think that is another conversation.
Yeah.
That exists in a different silo from the specific policy question we're discussing right now, which is 2 years or 1 year. And a report back about the implementation or the incorporation of just misdemeanors. And we want to have that conversation too about the accountability, of what's happening. I think we can have that. But I do think it's somewhat separate from the specific issue we're discussing right now with the amendment that I think Aaron would be working on. But it's also my understanding that we could vote on that and get a clean copy of what we've just described. Going from the 2 year look back or implementation date, going from 2 years to 1 year. And requiring a report back on January 15th.
Probably whatever it falls, first convenient.
January 15th sounds like a good report back on the feasibility of the implementation of just misdemeanors. And leaving it at that.
Yeah.
What other,
In other words,
what other charges would go under besides misdemeanors? We're looking at raise age to 19.
well,
We put them in a judicial,
Non-violent
fall under the-
felonies.
such as
Breaking that window.
I'll do a $500 fine again.
Anything felony, like we built up to over 1,000 as a felony. There's a lot of small stuff that's a felony.
Burglary into an occupied dwelling now. Since we took it out of Big 14 last year.
Yeah.
that sounds good to me.
So I would somewhat reluctantly entertain a motion to vote this out.
That should explain that.
So I want to just be clear, I am supportive of this amendment and it moves thing in a better direction. So I will vote for the amendment. I won't vote for the overall bills. It doesn't get me to a spot. So I just want to be clear that I'm voting on the right thing. Okay.
Well, wait, no, I think it was a straw poll of
On the amendment.
voting on the amendment.
Okay.
And Eric will be getting us a clean copy, but what I would entertain a motion to vote out favorably H2
As amended.
as amended, yes.
Can I, so when we were speaking earlier, and I was saying clean copy, this has gradually become a little bit more complicated. So I can obviously get you a clean copy. Timing is an issue. If this report, so for example, this reporting section that's in here now, are you envisioning, so those dates are all gonna have to be changed. Are you thinking that this additional report, which is going to be separate from that report, this is the report that's due January 15th, solely to do with feasibility and implementation for misdemeanor offenses?
Yes.
Okay, so that's going to be an added piece that DCF reports on, presumably?
Yes.
Okay, so what about this other than, that you're also talking about, we also have this sort of progress report, it's keeping, the separate thing that's in there now. Keep that as it is, but maybe change the dates, or if you're talking about timing, for example, you could add in some of what you had last year, have them report to justice oversight a couple of times. In other words, you maybe, since this now gonna have an implementation date of July 1st, 2026, right? Not 2027.
Thought it was April 1st.
April 1st.
You want to do April 1st again?
That way we're still in session and can actually talk about it. If we do July 1st, it's going to go into effect while we're not here.
Yeah.
Yeah.
So
And as painful as this entire, well, maybe not painful, but I think it's worthwhile to have the conversation again, even though.
It feels like Groundhog's Day.
I would suggest, Mr. Chair, that we could, straw vote and get Eric working on the amendment, and then when we come off the floor, whenever that is, we all immediately come down here and take a look at the clean copy
I
and
was
vote.
just the same thing.
Is that doable?
I think so. What's your floor?
We're on the floor at 11, we'll probably be off at 1.
Oh, yeah, that's fine.
Something like that.
I'm gonna suggest the same
Can
thing.
I ask a quick question? Just a yes or no, doable or not doable? Yes or no for the defender general's office, not paying attention.
What, I didn't see it, was it doable?
Yes,
Sugar his head.
I say our office
Sugar his
is
head.
gonna go right now. We could do it right now, if we had to. We could do it in a year.
Well, then I'll make sure it'll either it's doable, more important, but.
I have a gate out there yesterday's time, like afternoon. But what was that? Just rushing at the last second, to get something out.
Which is sometimes how crossover.
Yeah.
This is a crossover,
Well, I'm just saying.
but it has the same time to deadline.
Yeah.
Absolutely.
I also don't think though that this change that we're suggesting are broad sweeping or
Yeah.
heavily substantive.
So it's a year, April 1, report back January 15th.
Yes.
On the inclusion of misdemeanors.
Yeah.
Okay, it's that simple, right?
Yes.
Yeah.
Nothing else, Eric?
Yeah, I'm not gonna stick anything else.
Yeah, right.
No.
I'm gonna slide some decrim in there while we're at it.
That won't surprise me.
Hey, I'm
Well, I think
honest
it's
about
after
enough.
the April 1st again, puts you in the same position next year.
Yes,
So, you know.
Yeah.
we're gonna have to do this again.
Right.
We love it. We love term law.
That's a good point.
And accelerated.
Well, tough conversations
That's
are
right.
expected to have.
So
Well,
have we straw voted and assigned that tonight?
let's, yeah, yes, we can straw vote
On the amendment.
on the amendment. So all those in favor?
Yes.
It sounds like after you guys get off the floor.
Is that a yes or no?
Yes or no?
So 4 yes, 1 no, to the amendment.
Once the straw vote to get the amendment to us, we're gonna come back again and vote on. Yeah.
Say that again, sorry.
So we are gonna come back and have a formal vote.
Oh, right.
On the amendments.
Yeah, sounds good.
All right. We're gonna have a whole 16 minutes, thanks.
We are adjourned. For now.